Hi everyone, Dr. Moses here. So today I'm going to be talking about norovirus. That's N-O-R-O, norovirus. And it's going around significantly right now. Cases are surging all over. It is a virus that causes gastroenteritis. That's vomiting, diarrhea, abdominal pain, abdominal cramps, and it is very, very, very contagious. If one person in the house were to have it, the likelihood that it's going to go through the house is very, very high. So I just want to, bring up a few points that we should note about this norovirus. So number one, it is a virus. There is no vaccine for it. There is no treatment for it. All right, the virus is very contagious, and you can get it from eating foods that have been contaminated by this virus. You can get it from coming into contact with someone that has it, touching contaminated surfaces, eating food prepared by someone who has the norovirus. Sometimes if someone vomits, you have millions of particles in the air, and you can certainly inhale and breathe it in and ingest it. It takes less than 100 particles, in some situations less than 10 viral particles, to actually get infected. So it is very, very contagious, and it is spread easily. Bottom line is, if someone has it, they have a very, very high chance of giving to someone else if they come in contact with that someone else, especially if that person is preparing food or handling food that others are going to eat, because they can easily contaminate all of those things. We see outbreaks in many places, daycare centers, hospitals, sports teams, cruise ships are notorious for the norovirus, notorious. So for all those going on cruises, wash your hands before you eat. Well, let me take that back. For everyone, wash your hands before you eat, because a lot of times you are giving yourself the norovirus because you may have picked it up on your hands, and then you make food and then you eat it, and that's how you get it. So make sure you're always washing your hands before you eat. But yes, it's definitely very common on cruise ships as well. So those are some of the ways that you can get it, places that you can see outbreaks. And as I was alluding to before, how can we prevent ourselves from getting it? This virus is tough, right? It can withstand extremely cold temperatures, and it can withstand extremely hot temperatures, so it can live in surfaces in different kinds of temperatures, and it can hang around for a while. So it is very important that if you are in a place maybe where someone has this infection, you can't just wipe your surfaces with alcohol-based things, because it resists that too. You typically have to use bleach, to wipe down surfaces and things like that. Bleach is strong enough, so to speak, to kind of destroy the norovirus when it's on surfaces. Just make sure, obviously, you're using safe type of bleach and things that are formulated for cleaning surfaces. So bleach-based products typically are good enough to wipe down surfaces, but alcohol-based products, this plant-based products that are safe, a lot of those things don't really get rid of the norovirus. If somebody uses the bathroom that has norovirus, wipe it down with bleach-based products. Wait at least 5 to 10 minutes before using the bathroom. The best thing to do is isolate that person to just one bathroom, and everybody else use other bathrooms in the house. The bedding, the clothing, all of those things that have been used by this person, put gloves on, take it, wash it. You just want to not come into contact with the virus as much as possible. That's number one. Number two is hands. The hand sanitizer, again, not good enough for the norovirus. You have to use soap and water. So when you are at home or at school or wherever the case may be, and there's someone in the area that may have it, always make sure you're washing your hands before and after you eat. Make sure that you're wiping down surfaces. If you're touching things here and there, make sure you're not putting your hands on your face and your mouth. You're not biting your nails. Those are the ways you are going to get it, right? Is basically ingesting this virus or bringing it into your mouth through food or whatever the case may be. So we have to be very mindful that we're not putting our hands in our mouth and our faces, and that we're washing our hands. Now, treatment, nothing. There is no actual treatment for the norovirus. It's really just what they call supportive care. So you want to make sure you're staying hydrated. That's the biggest thing, is you don't want to get dehydrated. Most people that go to the hospital are going because they are dehydrated and they're getting IV fluid. So it's very, very important that you work on drinking electrolyte beverages. If you have vomiting and diarrhea, I advise against taking beverages that have too much sugar in it. The sugar can sometimes make the diarrhea worse. So you want to drink beverages that are well balanced electrolytes when you have this norovirus. Number 2 is, if your vomiting is profuse and is persistent, talk to your healthcare provider to see if they can give you medicine to stop the vomiting so you can stay hydrated. With the diarrhea, there's really no medication one takes for it. The diarrhea should resolve on its own, but sometimes being on a probiotic may be helpful, just to restore some of the normal gut environment. But it's not going to stop the diarrhea. It just, again, repopulates the gut with some of the good things that your body's losing through the amount of diarrhea you're having. Now, the time it takes from you to contacting the virus and being sick can be as short as 12 hours and as long as 3 days. So there's like a 12 to 72 hour incubation period almost, where from you ingesting the virus or being affected by it to you manifesting symptoms. So if I were to get norovirus now, I may not start having symptoms for another 12 hours, for another day. So you could be fine all morning long, and all of a sudden 4 o'clock in the afternoon hits and now you start vomiting, diarrhea. So the onset can be sudden. Thankfully, this illness tends to be short-lived. Most people are sick for about 1 to 2 days, maybe 3 days, but I don't typically see norovirus lasting for 7, 8, 9, 10 days. It's a very high-powered virus, very efficient, knocks you out for about 2 days, and then you're fine after that. Now, the diarrhea should not have blood in it, right? If you have bloody diarrhea, please see your healthcare provider. It may be something else. You may have a low-grade fever. You may have a headache. You may have body aches. A lot of those symptoms, especially the headache and body aches, tend to be from the level of dehydration from you vomiting so much or having diarrhea. So it's important that you stay hydrated. But if you have really high fevers that are not going anywhere, you're unable to keep anything down, you're lethargic, you're going hours without peeing, those are signs that you're probably very dehydrated. If you see that in your kids as well, maybe your baby that's in a diaper hasn't had a wet diaper for 6, 7, 8 hours. Your kids haven't used the bathroom for 8 or more hours. They're just laying around all day, refusing to drink anything. Please, please, please take them to your healthcare provider, take them to the hospital to see if they need fluids through the IV. Also, there's several different strains of norovirus, and let's say you get contaminated with it. Your body does make antibodies, but they're short-lived. They only last about 6 months. So you can get the same strain of norovirus 6 months later if you're infected by it. But you can get different strains of norovirus in the same year. So because you've had it once doesn't mean you can't have it again the same year, a different strain, and doesn't mean you can't have it again the next year, the same strain. So norovirus stinks. It's very, very, very prevalent right now, getting kids sick. So please stay healthy, stay safe, wash your hands, stop biting your nails, stop putting your hands in your mouth. And if you have it, please don't go to work. If you work in a healthcare setting, school, wherever it is you work, and you have norovirus, from the day that your symptoms end, I would give you probably another 48 to 72 hours, especially if you work in a hospital, before you go back. 3 days after your symptoms are done before you go back. Kids that are in school, everywhere else, I would say, if your symptoms are done, meaning your poops are normal, you're no longer vomiting, I would give yourself at least 24 hours extra before you go back. If you have active vomiting or diarrhea, please stay away from others so you're not spreading your germs. Thanks for listening. Until next time, stay blessed.